penetrating skull injury, coming from the front and then going out to the side as well. So it passed through bone, passed through the caverns of the brain, passed through the brain as well, then went to the other side. Okay? So obviously the patient was in serious, this was a very serious injury. Fortunately, by the time the patient came to present to us, they were actually fully conscious. We managed to stabilize the patient to get the CT scans that are required for operation, preparation for operation. We managed to operate on the patient. The spear was also encroaching on one of the bigger veins, one of the sinuses in the brain, but managed to control that bleeding. And the patient today, first day after operation, is actually quite stable. He's still in ICU under critical care, but he's stable. We expect him to be okay, to go back to normal. Yes, this was a very serious, very severe force. I say very severe force was used to try to penetrate bone in two places. Very severe force was used. He's fortunate that he's alive. This is actually very fortunate he's alive. That it missed all the major blood vessels in the brain. I think that's the most fortunate bit. I think it's quite. It's not often that we see these very severe ones, but the general trend is showing that there is a lot of this happening. Maybe the other injuries are not as severe. Maybe the other people when they attack, they are not as vicious as some of these cases. But the tendency is there. I think almost every weekend, any doctor who's worked at Mpilo Hospital will tell you we attend to a number of patients with head injuries due to assaults, whether it's penetrating or using stepping or no caries or things like that. This is quite a big problem in our area.
Okay.
Yes. I think it's a huge strain to the health services. It's a huge, for example, the patient who came in, this patient that we operated, we were supposed to operate on a brain tumor on the same day. So we had to cancel the other patient because this was an emergency. Unfortunately, our theatre time is limited because the theatres are used by almost everyone else. And we are short-staffed as well. There's only one neurosurgeon at Mpilo, which is a big hospital. And there are just a few other doctors in the department as well. So it's a huge strain to our resources. Every weekend we admit many patients for head injuries, mild, some of them severe, because of these assaults, and some of them because of road traffic accidents as well. But it's a huge strain. Our ward is always full, our wards are always full, but the neuro wards are always full. So yeah, it is a huge strain on our resources.
Okay.
Unfortunate that we've become a violent community. There's a lot of substance abuse out there among the youth, and the level of aggression and violence is escalating. So it's very unfortunate that we still see patients coming in with the spears stuck in their heads and so forth. I would not be surprised if this is a manifestation of the gross abuse of drugs out there.
Okay.
We are lucky that we've got a neurosurgeon here and another one at United Blair Hospital, and I'm sure they can handle this.
Okay.
Yeah. I'll leave that to the PRO to take you to the doctors and to the bedside.
Okay.